In 1952, polio killed 3,000 American children, but the genius of Jonas Salk changed everything in just 3 years, famously refusing to patent his discovery for the sake of humanity. To understand the magnitude of this achievement, one must picture an era where the arrival of summer didn't bring joy, but a paralyzing fear. It was a time when swimming pools were drained, movie theaters stood empty, and parents kept their children indoors, terrified of an invisible predator that left thousands of young bodies twisted and confined to massive metal tubes known as iron lungs. This was the American plague, and for decades it seemed invincible. The man who would eventually topple this giant was born on October 28, 1914, in the bustling heart of New York City. Jonas Salk was the son of Russian Jewish immigrants, a lineage that instilled in him a relentless work ethic and a deep sense of social responsibility. Interestingly, the man who would save millions from physical paralysis did not initially set out to be a doctor. In his youth, Salk dreamed of a career in law or politics, driven by a desire to fix the injustices of the world through social change. However, fate and his mother's encouragement nudged him toward medicine. Even within the walls of New York University School of Medicine, Salk remained an outlier. While his peers were focused on treating individual patients, Salk was captivated by the broader mysteries of immunology and the potential to protect entire populations through research. By 1947, Salk's reputation as a brilliant researcher led him to the University of Pittsburgh, where he became the director of the Virus Research Laboratory. This move was pivotal as it placed him in the orbit of the National Foundation for Infantile Paralysis, better known as the March of Dimes. This organization was a unique American phenomenon founded by President Franklin D. Roosevelt. FDR was perhaps the most famous victim of polio, having been struck down by the virus in 1921 at the age of 39. The image of a president fighting from a wheelchair galvanized the nation, turning the fight against polio into a patriotic crusade funded by the dimes of ordinary citizens. Beginning in 1948, Salk embarked on the grueling task of typing the various strains of the polio virus. At the time, the scientific community was divided on how to create a vaccine. Most believed that only a live, attenuated virus, one that was weakened but still capable of replicating, could provide lasting immunity. Salk disagreed. Drawing on his earlier work during World War II, where he helped develop an influenza vaccine for the U.S. Army, he believed that a killed or inactivated virus was the safer and more effective path. For 2.5 years, Salk worked almost without sleep. He utilized the revolutionary HeLa cells, immortal human cells, to grow the virus in quantities never before possible. By 1952, the very year the epidemic reached its horrifying peak with 58,000 reported cases, Salk felt he had found the answer. The bravery required to move from the lab to human subjects is hard to overstate. In a moment that has become legendary in medical history, Salk did not wait for official government trials to prove his conviction. In the privacy of his own home, he sterilized needles on his kitchen stove and injected himself, his wife Donna, and their 3 young sons with the experimental vaccine. It was a staggering gamble. If he was wrong, he would have paralyzed his own family. When the blood tests showed they had all developed the necessary antibodies without getting sick, Salk knew he was ready to tell the world. The tension escalated in 1953 when Salk published his preliminary findings. The nation watched with bated breath as the polio pioneers, a massive army of 1.8 million children aged 6 to 9, lined up on February 23, 1954, for the largest public health experiment in American history. These children and their parents were the foot soldiers in a scientific war. For over a year, the results were analyzed in secret. Finally, on April 12, 1955, the 10th anniversary of FDR's death, a massive press conference was held at the University of Michigan. The announcement was electric. The vaccine was 80 to 90% effective and, most importantly, safe. Across America, church bells rang, people wept in the streets, and the news was met with the kind of celebration usually reserved for the end of a world war. The U.S. government issued a license for the vaccine that very same day. However, the path to total victory was not without its shadows. Only weeks after the triumph, a catastrophe struck known as the Cutter incident. In May 1955, a batch of vaccine produced by Cutter Laboratories in California was found to contain live active polio virus due to a manufacturing failure. This disaster led to 40,000 cases of polio, 164 cases of permanent paralysis, and 11 deaths. Public panic surged, and dark rumors began to circulate, with some attempting to pin the blame on Salk's killed virus theory itself. But a swift federal investigation proved that the fault lay with the manufacturer's failure to follow Salk's precise instructions, not the science of the vaccine. The program resumed, and by 1957, the number of polio cases in the United States had plummeted by 90%. By 1962, a disease that once paralyzed tens of thousands had been reduced to just 910 cases. Jonas Salk's legacy, however, extends beyond the laboratory. When Edward R. Murrow famously asked him who owned the patent to the vaccine, Salk replied with a simplicity that stunned the corporate world. "Well, the people, I would say. There is no patent. Could you patent the sun?" While some modern critics and legal scholars suggest that Salk didn't patent it because lawyers told him the process was unpatentable due to prior art, this does little to dim his moral stature. He never sought personal wealth from the discovery, focusing instead on establishing the Salk Institute for Biological Studies in 1960 to foster further breakthroughs. Perhaps most surprising was Salk's willingness to look past the Iron Curtain of the Cold War. Despite the intense geopolitical tensions of the era, Salk collaborated with Soviet scientists Mikhail Chumakov and Anatoly Smorodintsev, sharing data and materials to ensure that the fight against polio was global. He stood firm even when rivals like Albert Sabin, who developed the oral live virus vaccine, dismissed Salk's work as kitchen chemistry. History, however, has vindicated him. Salk's inactivated vaccine remains the gold standard for safety in the modern era. He was a man who saw science not as a tool for profit, but as a shield for the vulnerable, proving that a single focused mind, backed by the collective will of a nation, can indeed conquer the darkest of plagues.